In this episode, you'll learn from a professional running physio / physical therapist what runner's knee exactly is, how to fix it, how to avoid it, immediate treatment, 8 to 12 week follow-up treatment, ongoing lifelong treatment for runner's knee, a few other secret hacks, tips, and tricks, and a bunch more. Let's get into it.
Case number 1, we have Sarah, who is a 32-year-old woman who has recently started running after being relatively sedentary. So she's been sitting around not doing anything. She's completed a Couch to 5K program. Everyone loves that. And is now running 3 to 4 times per week, but has been experiencing pain in her knee. Specifically, she reports pain around the kneecap, especially when going up or down stairs or when sitting for long periods with her knees bent. So with our framework that I've described, what would you diagnose her with?
This sounds like patellofemoral pain syndrome, also known as runner's knee.
All right. And what would be the immediate treatment?
Oh, I see lots of these actually, and I always want to reassure the athlete or the patient, like, this is okay, this is normal, these things can happen with running, particularly more so with novice runners. Considering it's her first injury, a lot of it is education on how to balance running training. She's just finished the Couch to 5K program, which is, I think, is fantastic to have that gradual increase in time and kilometres. But I do see once they finish that program and they get, really confident and start running, 5Ks 4 times a week, and it's still rapidly loading up the structures in her knee, and that's what's led to this presentation. So a bit of education with the first session. Secondly, I don't recommend anti-inflammatories for all injuries, but this one would do well with a bit of ibuprofen. So I'd recommend ibuprofen twice a day, 5 days or so. And I prefer ibuprofen over other anti-inflammatories because it's better for your tendons. Then we'd look at doing a bit of quads release work, simply because when the knee's in pain, quads don't fire as well. We just want to get a bit of release work through there. Then we can start looking at strength. Now, my go-to exercise for presentation...
Oh, hold on.
Yeah?
Sorry. So that was immediate treatment. So she came in for that first visit.
Yes, yeah.
And now, would you do strength even in that first visit?
Absolutely.
Oh,
yeah.
okay. All right,
yeah.
cool.
So what we'd do with her is we'd get the ball rolling with strength. I'd likely get her doing a wall sit. Wall sits are a nice way to get some quads activation without actually stressing the knee joint. You just need to make sure the person has the feet far enough in front of their body so when they sit down into the squat, they're not compressing the knee joint because we already know it's inflamed. That's usually the first place where I'd start. Get them to have the ibuprofen. Unfortunately, no running this week. The pain is too high. And then in the week's time, we could see if it's settled down and whether or not we can get her doing some run, walk, run stuff again. I don't like to hold runners or patients back from running too long because then we just see a further decrease in their load tolerance and it gets harder for them to re-enter the training they've been doing. But the pain's got to be at an acceptable level. All
right. So what would ongoing treatment and strength training program be for Sarah?
So the best evidence with patellofemoral pain syndrome is strengthening the quadriceps as well as the glute medius, so hip stabilizers. So a lot of her training will be around that. You usually start with something less functional and then you want to then progress into function. So you may start off with side-lying leg raise with a band to start getting some work through the glute medius. And also, again, your wall squats, split stance wall squats, eventually moving into exercises such as the Bulgarian split squat because it's targeting both our key muscles, the quads and the glutes.
Which we talked about in possibly the episode before this after this. And we'll have videos and stuff on that. Keep going.
As she progresses, and this is once her pain's more at an acceptable level. And I say acceptable being less than a 5 out of 10. It's responding well in that 24 hours after running. We'd then look at, continuing to improve at the kilometres that she's doing. I probably would have re-entered her somewhere in the Couch to 5K program. You could always do like 3 weeks back to, 4 weeks back, whatever she can comfortably do and continue on with. You could also consider gait retraining. Again, I'd leave this to later on because you don't want to throw too much stuff at this novice runner straight away. But once she's back running, we could look at how many steps she's doing per minute, what her stride looks like, and see if we can take the load off the knee by increasing cadence.
Is gait retraining similar to like running form?
Yeah, it's looking at your running form and what we can do differently to offload certain structures.
Got you. All right, so you've already talked about the follow-up, the ongoing strength training, immediate training, and what the diagnosis is. Anything else you want to say that people might not know about runner's knee?
Well, in runner's knee in general, Well, it's an umbrella term, so it's not. It's considered a clinical pain syndrome, so it's not one specific structure that we can blame for this presentation. But it may be the cartilage is a little bit irritated. It may be that there's some joint inflammation, even the neural structures, whether or not they're a bit sensitive at the moment. But it's a combination of factors which leads to this presentation.
All right. So it's not something to freak out about, as you said?
No. And I understand how, again, more novice runners get a bit freaked out with this condition, but it's just about settling the pain and then getting things stronger again and gradually building up your running kilometres.
Yeah. Would you say, my last kind of Darren weirdo contrarian question, you don't see this in the advanced and more experienced and pro runners. Would you say that more injuries for elite runners happen below the knee and then more of the novice runners, it happens like above the knee in the hip area?
Not quite, because the most common condition with all runners, but again, particularly more so in novice runners, is medial tibial stress syndrome. So that's shin splints.
Oh,
so that's
okay.
a key one we see a
And
lot
that
of
is
the
lower leg,
time.
yeah.
But runner's knee I do see, again, more frequently with novice runners. I haven't got any data on it, but just from my clinical observations, I see, much more newer runners with this condition.
If you want to learn more about this topic, we went into further detail. You should go and check that out right here.